Hello, Thought Roomies. What is up, my friends? For any of you who don't know me, I'm your host, Hallie Rose. We've been making some big changes over here at the Thought Room as we grow and expand. And for any of you who follow me on Instagram, either on my personal account or on the Thought Room account, know that I really love to engage with the community as much as possible. And what comes out of that when you connect are these really, really beautiful opportunities. And through synchronicity, I recorded a meditation last week, actually with a listener of this very podcast. So we were connecting and he sent me some of his music and I was so fired up. And later that night, I lit a candle. I set a sacred space for myself at my altar and I said, all right, this song is 5 minutes, and I'm just going to take 5 minutes and flow from the heart. During this whole time, I've been doing my own dance with intense feelings and moods, and I just said, what does my heart need to hear right now? And so I hit play on the music, I hit record, and we did it in one take. I just flowed from the heart, and I sent it off to him, and we released it the very next day. So the result is this meditation we created called 5 Minutes to Inner Freedom. It's only 5 minutes, and whether you're a beginner meditator or an avid meditator, you know what I probably mean when I say that sometimes there's a resistance to carving out time to meditate. And the good thing about this is it's short. It's just long enough to pause and pattern break your thoughts and your feelings that might be swirling around you today. And I want to give it to you. And you can get it right now for free. All you have to do is go to www.hallierose.com/meditation. And really, the only thing holding you back is your own decision to take it, because I've removed the money factor for you. It's free. I produced it. We packaged it up in a nice little MP3 file gift for you. And I feel that we've done everything in our power to make it so easy for you. All you have to do is take that step and download it so you can get that again for free at www.hallierose.com/meditation. It's only been out a few days, but so many of you have already downloaded it and have been sharing with me on Instagram about your experience. I even pinned a little story about meditations on my personal account, which is at Hallie_Rosebud. And I've been sharing your responses and your experiences. So if you do the meditation and you enjoy it, please let me know by tagging me at Hallie_Rosebud or DMing me. And I would love to share your response with everyone else. When you download the meditation, it's a one-step process. It's really easy. You just punch in your name and your email, and then it takes you straight to a download page. You don't even have to wait for anything to be emailed to you or anything like that. You can get the instant download. And I ask for your name and your email because I want to share stuff with you. And if you get the meditation, you'll get double the goodness because it'll sign you up for my dope email list that I'm about to begin writing, which I will share so much extra content with you. Things like more meditations, podcast announcements, my personal music playlists I curate, excerpts from my book I'm writing, poetry, recommendations on books and audiobooks that I'm reading and studying from time to time, and all of that good stuff. So if you love to learn and challenge yourself to heal your wounds, to push past old patterning and become a better person every day, I think you're really going to get lots of value from my occasional heart musings. And again, you can sign up for that at hallierose.com, either with or without the free gift of the 5 Minutes to Freedom meditation. I am currently in Charleston, South Carolina, where I had the pleasure of meeting up with Dr. Craig Koniver. We've had so many amazing interviews in the queue, actually, before the whole pandemic went down that I recorded. I have, Amanda Bucci lined up, Aaron Alexander Roxo, to name a few. But this interview with Dr. Koniver came along, and I felt like I needed to put it at the front of the queue because it is super timely and super important. Dr. Koniver has been practicing performance medicine as an MD for over 18 years. Not satisfied with the disease-based model of modern medicine, which generally treats through pharmaceuticals and through surgery, Dr. Koniver was really seeking to help his clients optimize their health and performance through a more wellness-based approach. He's using all sorts of really neat things, which we dive into in the interview, including NAD plus IV, vitamins, and ketamine therapy, which is new and cutting edge. And I think you'll really find that part of the interview super fascinating. Dr. Koniver's client list includes Navy SEALs, NFL players, PGA golfers, UFC fighters, Hall of Fame NHL players, and executives, congressmen, well-known celebrities of all sorts. You might have even heard Dr. Koniver on several of your favorite podcasts, including the Aubrey Marcus podcast, Kyle Kingsbury podcast, Ben Greenfield's podcast. Some of the questions that we explore in this episode are, what has been the trajectory of the global pandemic of COVID-19 from Dr. Koniver's perspective, and what role has fear played? We examine the efficacy of masks and consider what the mental health fallout of the virus will be. I asked the question, how does loneliness, depression, and isolation tie together with this, and will there be a second wave of this virus? We touch on vaccines, civil liberties, and personal sovereignty. Then we dive into a really deep discussion on hormones. And Dr. Koniver believes that hormones could be the most influential factor in affecting an individual's well-being on a day-to-day basis. So we get to talk about the link between hormones and depression. We talk about miracles. What is a miracle? And we explore this question, can changing the energetic vibration of our being by tapping into the power of reprogramming the subconscious create miraculous recoveries? So without further ado, please join me in the thought room with Dr. Craig Koniver. Dr. Craig Koniver, thank you so much for being in the thought room with me today. It is such a pleasure to have you on the show.
Yeah, thank you for having me. It's a pleasure to be here.
I was saying to you before we started recording that I have had you on my short list of guests I really wanted to touch base with. And I just happened to be in Charleston, which is your hometown.
Right.
And I'm in your beautiful new office here. And it is, again, just such a joy. Thank you so much.
Yeah, no, thank you for thinking of me and for wanting to do this. Yeah.
A lot of our listeners will probably know who you are because they follow, I mean, you've been on Ben Greenfield, you've been on the Aubrey Marcus podcast, you've been on Kyle Kingsbury podcast. And so a lot of our listeners will have overlap. But for those of you for those listening that have never heard of you, can you give a little background about who you are, what your credentials are, and maybe we'll dive into what I think is so special about you as a doctor, as an MD.
Yeah, so we have a practice here in Charleston called Koniver Wellness. I opened the practice after I finished my family medicine residency in 2006. And I opened my own practice because I wanted to do things differently. And by different, that was kind of get outside the confines of conventional medicine. And early on, we started with a bunch of nutritional IVs, kind of specialty lab testing. And here in Charleston, I was the only doctor to kind of, practice in that arena. So my practice got really busy really quickly. And it's, evolved over time. And now in 2020, we get to do some really neat things that a lot of people are interested in, such as peptide therapy and stem cells and ketamine therapy and using intravenous NAD and lots of different really high potency tools that, the biohacking community likes. And, we base it all on science. And we really like to, be the edge of that cutting edge and help push the envelope about what's safe, but what's also effective.
What I think is so interesting about this, and of course, I'm a little biased because I already told you the background of my parents being chiropractors, and I've told this story before on my podcast, but when I was growing up, my dad had a poster in his waiting room of his office that was an iceberg, and you can see the iceberg above the water, and then there's like this big, massive other part of the iceberg below the water, and it says, symptoms are the tip of the iceberg. And I think this is kind of like, I like what you're doing because it seems like it's a fresh take on the standard medical paradigm. It's more it's more proactive. It's less treatment of disease focused and more about well-being. Would you agree with that?
Yeah, I think, if we look at the, conventional medical model, I think it's flawed in terms of it's flawed if you take the perspective that it's going to help people feel good and be well. I think it accurately helps people in the disease process, right? Because it's really based on two paradigms. One is pharmaceuticals, the other is surgery. And so, I'm not saying all medical education is this way, but certainly mine is that doctors are trained to think along those two kind of highways. So a patient comes in and starts, describing their complaints, and the doctor's thinking this medicine, that medicine, if that doesn't work, what referral? And that system doesn't take into account kind of the holistic nature of the individual patient at all, right? Because each of us, while we're comprised of different organs, we have different DNA, we are not robots. We don't function along a linear pathway. And more so than that, I think at the heart of it is patients don't necessarily want a label as a diagnosis. Patients want to feel better. And if you look at our society, we are a society where greater than 50% of adults are overweight, tired, depressed, on multiple pharmaceuticals, and they're not making any progress. We have more heart disease, cancer, autoimmune disease, neurodegenerative disease than ever before. It's only rising, even with all of these pharmaceuticals, even with all of the chemotherapy, even with all of the surgery. So that paradigm, it doesn't address things. It really helps people in really two scenarios. If people are sick, if people have an infection, say strep throat, yeah, antibiotics seem to make sense. Life, threatening things, people end of life, really, really sick, and they need to be in the intensive care unit. Okay, we need to do some high technological things to help people. But people who are looking to be well, like you said, be proactive, promote their health, get to the core issue of why they don't feel well, the current medical model can never, ever address that, ever.
This is so fascinating to me. And of course, with what we're seeing right now, with the global pandemic, I have been so curious to know, I guess, how you've been observing the trajectory of this whole thing from, the onset of that massive curtain of fear that just fell over top of everybody, and some of the knee-jerk reactions. And now kind of as things are starting to open back up, I'd love to hear what you're seeing in your practice and how you personally were dealing with it and within your family. What were the choices you were making? And, what can you tell the rest of us?
Yeah, so I think from the beginning, it really seemed to resonate to me that the pandemic was fear, not the virus. And so people know, and I think people understand this, yet they tend to forget, we are constantly bombarded with different viral threats or pathogen threats, viruses, bacteria, parasites. In fact, something I like to tell patients is, if you look at our DNA, there's more foreign DNA in the human genome than human DNA. And that's because in our gut, for example, we are loaded with bacteria. So we have to have some sort of parasitic type of involvement in the world, in the environment we live in, which involves other pathogens. It's just part of being human, and it's fine. And the idea that a virus of any kind should come in and totally change our way of life, and that we need to run and isolate and hide and insulate, makes zero sense to me, right? Because that is never a way for us to flourish, grow. And I think, from a practical standpoint, what seemed to would have made more sense if we quarantined the high risk, and we can look back and say, I think the statistics now are 96% of people who contract this virus have no symptoms and recover very quickly. Well, statistically, you can never get to 100% on anything. So if we're at 96%, that's as close to 100% as we'll ever get. So what are people scared of, right? Like, let's ask that. What are people scared of? So are people scared of getting the virus? Well, that doesn't make sense because the vast, vast, vast majority of us will, if we get it, we'll be totally fine. Are people scared of dying? Well, that's legitimate. And that's probably a larger question that I think is worth exploring. Are people scared of, like in my instance, if I have a fear here, I'm scared of losing my civil liberties. I'm scared that people will say you have to isolate and can't be in a community, which, as we know, and I'd like to point out, your chance of death increases by 45% if you're isolated, right? So yeah, we've isolated people, we've insulated people, and people say, well, this is how we flatten the curve. I don't know if that's true. Like we can never look back and say if we didn't, what would have happened, right? It's always, so it's easy for people to ring the bell and say, what we did worked. We don't know if it would have worked the other way because we never did it. But if we look at other viruses as they kind of travel through populations, I think it would have made more sense to quarantine the high risk because those are the population, those who are older, that's the number one risk factor. Those who have other comorbid diseases, heart disease, diabetes, whatnot, obesity, and then let the virus run through the community. This would have been over a long time ago. We wouldn't have had the economic devastation. We wouldn't have had the isolation, the fear. We wouldn't have had all these other problems that are going to be massive for the years to come and how we deal with them just from the psyche point of view. So the whole thing to me is really unfortunate, right? And I think there's going to be a lot of gifts that come from this. I think it's a wake-up call for a lot of people in how we go about, one, our own individual health, two, what we think of community health and how we go about that. So there definitely will be gifts for sure, and we have to have that perspective. But looking back, yeah, I think the whole thing was mishandled.
I think what you're saying is going to resonate with a lot of people listening to this. But there is also a group of people that are going to feel, and I've seen this just, there's a variety of reactions to this. Anyone can go on their own Facebook and just see a whole rainbow of different reactions. But I've seen some saying, do your civic duty by wearing your mask because you might not get sick and die, but you're exposing people, and that's murder. And that's, so I've seen that sort of a reaction where it's like the fear is actually like not for me, for example. It's like, oh, I'm going to get somebody else sick and that makes me bad. Like what is your reaction to that sort of a mindset?
Well, let's back it up. Number one, they've done studies on people wearing masks. We haven't done studies on people wearing masks with corona because it just hasn't happened in it yet. So the studies we have are on things like the flu. And the studies show that wearing a mask don't do a bit of good, right? So that's
nothing.
No. Let's look at 6 feet, arbitrary. Like where did they come up with 6 feet? It was made up. Like maybe 12 feet was too far, 3 feet was too close to 6 feet, seemed about right. But the most important point is everyone has the opportunity, if they feel uncomfortable, if they're scared that they don't want to contract it or spread it, to isolate themselves. But why does your fear that you want to isolate infringe upon my right to not want to isolate? And I would argue that not isolating is a healthier approach. Again, the high risk, I get it, right? Those are the populations going to get sick. They're in the 3 to 4% who will get sick. 3 to 4% is so tiny. And so then we have to take a step back and say even further, why all of a sudden do we stop our life for one virus, right? Like your chance of getting hit by a car is way higher. I think it's 3 times higher than getting corona. Your chances of, depression, suicidality, alcoholism, way higher. Malnutrition, all these things are way higher than getting corona. So why don't those matter, right? And so I get it. The virus is very real, and I think we have to take it seriously. When people get sick, we need to be there to help and support them. And that's all well and good. But I don't understand why, people who want to go out and take the risk, because life is not guaranteed, and also part of living is dying. that's just a part of it, that we can't live our life. And I know that the argument is, no, you're, like you said, it's a civic responsibility to take care of the community. I don't think you're taking the care of the community when you don't address all of these other things. I don't think you're taking care of the community when you're not talking about dying gracefully, right? Like some people who I know, I don't know anyone who's gotten the virus, but people I know who we've had these conversations, if we talk about, okay, I mean, I know a lot of people who say, I want the virus, right? Like I want to build antibodies. And I also know people who would say, if I got sick, I don't want to go to a hospital, right? Like I will rather die at home. Like, let's have that conversation. Like, why isn't that okay?
You bring up some really good points. I'm thinking about this kind of like natural inoculation by like being out. And also just some stuff I was reading about this fear of a second wave. So I want to ask you about that and sort of this natural inoculation or building immunity versus, you know, now people are talking about vaccines and you're talking about sovereignty. And I want to ask you how in your mind all of this sort of ties together.
Yeah, I'm a big civil liberties person. So I think everyone should have the right to choose with proper information. So the key there is, you know, allowing people to get that information. So one of the things we've seen from Corona, we know that's come out is a lot of censorship and curating of information, right? Where the powers that be, and it's well proven on YouTube, are taking down videos where there's voices of opposition. So people can't make informed consent if the argument is only one-sided, right? And I would, you know, argue that no matter what it is, whether it's taking a vaccine, taking chemotherapy, taking an antibiotic, all of us have that right to choose what we want to do. But that choice should come from, right, informed consent. And if we look at, for example, vaccines in general, and you have the big group of the anti-vaxxers in general before Corona who said all vaccines are bad and dangerous. I don't agree with that. And then you have the public health side who says every child and every human needs to get all the vaccines. I would say, well, let's look at the history of vaccines. Vaccines have done a lot of good in the public health arena to help us avoid or prevent disease transmission, reducing severity of disease, for sure. However, there is going to be a small percentage of people, we don't really know because we can't talk about it, who are vaccine injured, who don't necessarily do well. There's an incompatibility with getting that vaccine. And so those people should be able to delay or hold off on getting the vaccine if they so choose. And that's what they're doing to themselves. And that should be allowed versus saying they have to get a forced vaccine to protect the community at large. The community at large can protect themselves if you want to stay home, if you want to get a vaccine, if you never want to drive your car because you're afraid of being in a car accident. That's totally your choice. And you can make that with whatever decision powers you have. But the rest of us should be able to make, with informed consent, decisions not to do these medical treatments as well. And I think it's a really slippery slope that people probably aren't taking into account. Once you allow forced vaccination, why then aren't we going to allow forced chemotherapy, forced antibiotic therapy? You know, and I know what some people will argue, even on the legal side, well, if someone has cancer, they're not a threat to the rest of the community. Well, they kind of are because they're using resources, right? They're using a lot of resources, money, to pay for chemotherapy, to pay for the care of that person. So I don't think that argument stands up. I don't think it's in anyone's best interest to force anything. I think it's in everyone's best interest that we actually have a real conversation and speak truths, no matter how uncomfortable that is. For example, we know that the CDC collects information on vaccine injuries, but doesn't make that information available to the public easily. Why? Because they want to give the impression that all vaccines are safe. And that's just not fair, right? Because I know a lot of patients, children and adults who have gotten vaccines who have had adverse reactions. And I know people will say, well, it's okay to sacrifice the few for the many. I don't know if that's true. I think that's an ethical, moral question. And if we're going to go there, then we need to have real, honest, authentic debate about that instead of pretending that it's one-sided.
That's interesting. Even that it's okay to sacrifice the few for the many in regards to vaccines and these adverse effects. Technically, the alternative could be argued as far as letting people go free and like the whole
exactly.
While we're sacrificing a few, for everybody to build their own antibodies. I mean, I'm not saying one is right, but I'm just saying it's interesting how we become attached to certain perspectives and don't consider.
Well, and there's, and not to make this too polarizing, but it's a good example, the argument, my body, my choice has been used
totally
for years in the abortion discussion. But that same argument now doesn't apply when you're talking about wearing a mask and what you want to do with a vaccine. So that's a double standard.
Interesting. I want to jump back to something you mentioned before about sort of like loneliness and the kind of the isolation aspect of this pandemic. It's got me thinking about newborn babies and like failure to thrive through not being held and stimulated, and sort of also if you go back to tribal cultures, it's like isolation was, if you became isolated from the tribe, you were dead.
Yeah.
So it was the ultimate death, death before death. And to segue into this question is like, what do you think is going to be the mental health fallout of all of this? And is there anything people can do to kind of get ahead of it for themselves?
Yeah, I have a couple of thoughts. One, I'll mention I have a patient here in Charleston. Her dad contracted corona. They drove to Alabama. He was isolated and eventually died. And she was not allowed to see him at all. And so couldn't get closure. And that choice was taken from her and her family to be with him. That's devastating, right? And even though he was on a ventilator, people would say, "Oh, well, he doesn't care." Well, he's a human soul. He knows energy, and he knows that he was not allowed to be with his family when he died. That's a terrible travesty. And so that's number one. Like when you talk about isolation. And then number two, I think part of the problem here we've set up, actually it was the perfect setup with social media, right? In that we're teaching people that it's easier to message and be on your phone than actually be in human touch and human contact. And so I think one of the gifts to come from this is, how far did we want to push that message that everyone's on their phone all the time and we've all known it. We're all distracted and we'd rather communicate with people digitally than in person. And I think most of us have sensed that there's this growing problem there. And I think now that we've been forced to, physically separate from people, it hits home that I think that a lot of it's been digitally set up for a long time. And I think one of the gifts here is, we're human creatures. We absolutely need human touch and to be together and to, have a community. And without that, our society as a whole will have a very quick demise. Like it's not sustainable at all.
It takes the joy out of living.
Yeah.
It's like kind of what's the point of being here if we can't be together, co-create, enjoy each other's
exactly
existence, right? So
I totally agree.
Yeah. And this is a great kind of curtail into depression, topics of depression. And that's always one of my favorites because I've had my own dances with it and my listeners know that. In fact, I've kind of been going through it a little bit again with all of this and just some personal things like a breakup in my life and integrating all my ayahuasca experiences. So it's been interesting and it's right at the tip of my awareness now. That's why I want to ask you about it. But in particular, I also want to talk about hormones in relation to depression too, because when you and I first met in Austin, I asked you some questions about Lyme's disease because, I contracted Lyme, 4 or 5 years ago. it's one of those diseases they say that you can never get rid of, although I do not experience symptoms of Lyme's disease anymore because I did a lot of alternative therapies and saunas. And so I'm grateful for that. But during that time, my body just went into such a state of inflammation. Everything was haywire. I was suppressing a lot of emotions. And I actually stopped menstruating completely. I had been on birth control and then I got off of it. And I was off of birth control for, like 3 months and my period didn't come back. And then 6 months and my period didn't come back. And they're like, oh, it's okay. Like it'll just take some time. And then after a year, I was like, this is not coming back. And I was 27 at the time. So there's like, I was fit. There was just, I was eating super healthy. My parents are into nutrition. There was just no reason why this wasn't happening for me. And the fallout was, I had my estradiol levels taken and they were just, they came back and they were just like, yeah, your levels are basically somebody who's perimenopausal, like you're going through menopause.
Yeah.
And so in summation, it was just like my mental state trying to be a 27-year-old and having no vitality, no sex drive, just like it was the most depressing chronic state one could be in. So I'd love for you to speak a little bit to those listening who maybe are experiencing feelings that actually could be connected with their hormones.
Yeah. I think of a simple analogy to help sum this up is if you think in primitive times, so it goes back to the relationship between cortisol and the hormone progesterone. And it's not a good setup for someone to be pregnant while being chased by a lion in the jungle, right? Like if you're fearing for your life, then it's not a good environment to have a pregnancy. And so that is how we've been created, is that there's an intimate relationship between our stress hormone, cortisol, and then these sex hormones, progesterone, estrogen, testosterone. But like I tell people, cortisol is the big bad bully, and cortisol will always win out. And so if you're stressed, and that stress can be from a lot of things, it can be from a pathogen like Lyme, it can be from emotional stress, financial stress, physical stress, pain, anything that is you perceive as dangerous to you will instigate this cascade of trying to make cortisol, right? Because cortisol is there as a buffer to save our life, as an anti-inflammatory. And that whole interaction with other hormones is complicated, but we know just from what you just described that that's what was going on, right? So, well, let me say this. So menstruation is driven by ovulation. Ovulation is takes estrogen and it takes, a healthy whole hormonal circuit to work. And when that gets disrupted, and many times it gets disrupted because of how we, put out cortisol, then the fallout is, in your case, you won't have a menstrual period. And if you don't have a menstrual period after a while, then your body starts thinking, I don't need a menstrual period.
Totally.
Right? Like that's your new norm. That's your new baseline. And with that new baseline, you don't necessarily have the impetus to get out of that. And that's where people get stuck.
Totally. And because I had been on birth control, it's like, I'm giving my body that regular hit of those hormones. And so maybe you can speak more to this, but it was like, you stop producing them to some degree and then you pull them away and the body's like, well, but I usually get these just administered to me. And then, you're starting from zero and your body's systems that haven't been creating these naturally have to and it doesn't happen right away. It took me so much nutrition, emotional work to remediate kind of, I look at it as the damage that I had done.
Sure.
But
and part of that is because those hormones in birth control are synthetic, right? So they are so much stronger than your naturally occurring hormones. And because of that, and they serve a purpose, let's be clear, people take birth control for a few reasons. Number one, they don't want to get pregnant. And they absolutely can work that way. But there is going to be another side to that coin, is they're going to manipulate your other hormones. So then when you remove those kind of massive, heavy assault on your hormonal system, for a lot of times women, it takes a long time to come back from that. And so then the question is, well, what if we used natural hormones as birth control? It's hard to do because it's hard to kind of shut things down, manipulate that hormonal axis unless you're using some very strong chemicals. And those synthetic hormones are chemicals. Yeah, I mean, it's a challenge.
Totally. I mean, thank you for talking about this. This is an area that I'm personally very passionate about because I started a company to help young girls going through puberty celebrate their first periods. And so I'm really into, because of my own journey with it, I'm really into helping women get back in touch with their natural cycles. Because for me, the experience of not feeling like a woman, like I really didn't feel like a woman.
Sure.
And when I dove into my research about birth control and all of this, it was like, I didn't know until I started reading that when I was on birth control and I was getting a bleed, it was not a period, you know? It's not a period. It's a withdrawal bleed. And from what I read, it's like when they were developing birth control, at first there were no sugar pills or there was no break week off, and it freaked women out. They were like, I want to get this bleed. So it's kind of this like placebo period that's just kind of been injected into there. And the psychology of something like that really, really terrifies me. I'm sure there are people listening to this that probably didn't even know that piece of information. So,
yeah, I mean, and so the physiology is worth explaining because I think most people aren't informed about it. So, the cascade of having a menstrual period is set off when there's a decline in progesterone. So, after females ovulate, which is usually mid-cycle, you ovulate to produce an egg with the goal of conceiving to have a pregnancy. And after ovulation, then your ovary will put out progesterone. And one of the main roles of progesterone is to prepare the uterine lining for the pregnancy. So after ovulation, progesterone levels should go way up. And they should stay up until the point in the cycle where you determine, okay, there is no there is no conception, there's no pregnancy. And when that is, discovered, so to speak, then those progesterone levels decline. And when those progesterone levels decline, they go from a high point to a low point, that triggers the uterine lining to shed. So why would the uterine lining want to shed? Because it's shedding to prepare itself for the next month for the next pregnancy, right? So menstruation is really a way to prepare for pregnancy. And that's simply how it works biochemically. And what happens over time actually is the first female hormone to decline is progesterone. And so a lot of women then, if you're not putting out sufficient amount of progesterone, it will change how you feel during, the month for sure, because progesterone is really, in my opinion, the most important female hormone. Allows women to feel safe, grounded, secure, all of those kind of feminine things. And if you're not making that during your cycle, you're not going to feel very feminine. You're not going to feel like yourself. And as well, it's going to make it much more difficult to have a pregnancy. And that can be a double whammy in of itself. And then we know, like, for example, the number one cause of a first trimester miscarriage is low progesterone as well. So it's all tied into that, ovulation, menstruation, and then the femininity. A lot of it goes back to progesterone. I think people falsely say estrogen is such a valuable female hormone. Estrogen is needed for sure. Estrogen's important. But I think it's really about progesterone. And then that progesterone ties very intimately into cortisol. And so it's this very complicated web.
Thank you for that. And just to go into the male side of it, is there anything you want to offer as far as your thoughts on testosterone? And I heard you talk a little bit about it on Kyle's podcast. So yeah, I
mean, testosterone, it's interesting. We talk about it even in the context of Corona. So testosterone is a unique hormone because we call it a biosocial hormone. They've shown, people are familiar with this, with kind of the locker room effect, is that, especially with men, their testosterone elevates around more testosterone. Right. And testosterone, in the analogy that
mob mentality.
Yeah, can be. I think of hormones, I think a way of thinking of hormones is like kids on a playground. And so I reference cortisol as the bully. Testosterone's the happy, fun, energetic kid, right? Everyone wants to be around testosterone. Testosterone's a really positive experience for people. And men and women need it equally. Men just need a lot more of it. And so it's kind of the dominant hormone for males. And more so than the kind of bodybuilding connotation that people have with testosterone, it's actually really valuable to our nervous system. And so men who are cranky, depressed, just feeling out of whack, most of them have low testosterone. Like females, who start declining in progesterone in their 30s, men start declining in their testosterone in the same age range in their 30s. And for men, that's a weird time because they feel like they're not themselves, right? They don't feel very masculine. Their memory declines. They don't feel confident. They don't sleep well. They get depressed. I know I've been on testosterone for a long time. And before I started it, I was in that boat. Like the world just seemed to be a negative place, right? You feel grumpy. And starting testosterone, the world brightens up again. You can laugh again. You feel happy. And then for men, low testosterone is a big deal because it's the number one risk factor for heart disease, stroke, depression, dementia, these big bad diagnoses that tend to happen later in life. And so it's gotten a bad rap because people think of it like people are abusing it and getting these huge muscles, which people do. People abuse all kinds of stuff, testosterone being one of them. But I think testosterone is so critical for the nervous system and so critical for men for their just overall mental well-being.
How much of this around hormones is, we'll charge it to the game of just natural aging versus the environmental container that we're now seeing? There's xenoestrogens and all kinds of hormone disruptors for women and light and all of these things kind of are affecting our cycles. And I'm sure there's lots for men as well.
Sure.
What's your opinion on that?
I think that there's a lot to be learned. So I think that for whatever reason, we haven't figured it out. For all of us, as we get older, our hormones decline. I think there is a natural progression of that. And so I have a lot of patients who say, well, I don't want to do any hormone replacement because it's not natural. And I counter that by bringing up the point you're saying, well, in today's world, it seems to be happening way faster, right? We have a lot more negative influence from the environment. Herbicides, pesticides, or these xenohormones you talked about, which negatively influence our bodies. Nutritionally, things like soy can be dangerous for people. It's a hormonal disruptor. There's other foods that do that too, but soy is the most prominent. And so we have a lot more toxicity, heavy metals, plastics. They've done studies where they've drawn cord blood of babies being born, tested that blood, and there's hundreds of chemicals already in that blood. And that comes from the environment, right? And it's I don't like people to have the framework that we need to have fear about it, right? Like this is the world we live in, right? Like there's some people who say we should never use our cell phones, they're dangerous. That's not really practical. That's probably promoting more fear. Like we do use it, we enjoy it. And I think we're healthy individuals and strong that we can handle anything. And I think it starts with that mindset of, believing that you're healthy and strong. Like you don't have to buy into that fear. But there is so much more negative influence on hormones. I mean, I see it because we do a lot of hormone testing for men and women. Their hormone levels are declining in their 20s, way more than we used to see. And as hormones, that's a big deal because I think hormones are the number one or the most influential aspect to how we feel on a day-to-day basis. Yeah.
Very fascinating. So you do a lot of amazing things here. And I kind of just want to ask you, what's most prominently exciting for you right now in what you're doing in your practice? Whether it's, I know you're doing the NAD stuff. Yeah. I know you're doing ketamine therapy. So if you want to speak to just
Sure.
What's lighting you up the most right now in your practice and what you're learning?
Yeah, I mean, those two things probably, but probably the combination. So, talking about ketamine, right? So ketamine's become much more popular in the last few years. It's a dissociative anesthetic, so it's been used in the operating room for a long time. It's a very safe anesthetic, doesn't seem to cause as much respiratory depression as other anesthetics, so you can use it in children if you need to do a procedure. But in the last couple of years, it's become a very useful tool for things like refractory depression, anxiety, even chronic pain. And so we've kind of started using that in combination with NAD being the B3 vitamin derivative that works with our mitochondria, helps reset the nervous system, does a lot of wonderful things. And what's exciting is that the combination is we're seeing literally, I mean, I talk to people every day about not just feeling better, about life transformation. Like amazing things happening in a very short amount of time. Like the acceleration of healing to the nervous system in particular in ways that I haven't seen before. Like, it's happening faster and faster.
What are they noticing? Like when you're talking about healing to the nervous system, that means something to you and to me, but to the average listener, they're like, I don't know how that manifests. What does that feel like?
So, well, I can give you some examples. I have a patient, I just saw her last week, and she's in her 40s, has a couple kids, stressful. Her husband was sick, had to get a bone marrow transplant. She had the burden of taking care of the kids, working. He was in the hospital. And she would come in for the combination of intravenous NAD, and we used ketamine at the same time. And she came to my office and she was crying, and she said, I've literally healed myself in ways I didn't even know possible. Like, I am a totally different person now, and I have a totally different outlook. I am much more confident in who I am as a person, what my purpose is, what I'm here to give the world, what I'm here to contribute. I mean, very big things that go way beyond just, oh, I feel bad or I feel good. And it's those types of conversations, very profound, deep-seated, purpose, meaning type of revelations, which is where healing really happens, right? Because it's all about perspective, right? Like the way I think about it, if you had cancer, but you got the insight that cancer was actually healing you from something else, the purpose and the meaning of that would be very profound to you in ways that would be hard to articulate to anyone that, people would be like, oh, you got cancer, that sucks. Right. But maybe that cancer is a gift.
Totally.
Because it's about perspective. And so that type of healing, which we don't normally talk about because we're used to talking about a lot of peripheral things or superficial things, dominates kind of the landscape of medicine, but it's those kinds of conversations which are the most valuable. And so that's what's really exciting.
That is very exciting. And for me, it's about, it's shifting consciousness.
Yeah.
And I think about, again, having just spent a lot of time in Costa Rica, in the jungle, kind of working and learning it with plant medicine and thinking about some of these indigenous cultures and the shaman. And when people would come with ailments, they were like psychospiritual. Like every physical ailment had sort of like this other root. And the role of these shamans, these leaders, was to help you reframe what was going on. Like, oh, listen, you've got heart palpitations because this is happening. And so I think that's kind of edging on a different take on what can be done here. It's like you're going in, and in a way, the individual is doing this work on themselves. They're able to access these deep states to sort of see what's really going on.
Sure.
With their awareness and their consciousness.
No, I think that's a good way of putting it. And I think it's increasing, and I think part of it's increasing, or this transformation is increasing, because as more people become aware of consciousness, then more people can start believing that the role of the psyche, the spiritual role, plays such a dominant part in the physicality manifestation of wellness and disease. And because it really comes down to belief. If you don't even believe that to be possible, which is where most people are, right? Most people are too busy, and we've trained them to kind of base their life on fear, right? If you don't do this, then bad things happen. We have this paradigm of take this for that, right? If you feel pain, take a pain reliever. So people don't take the time to even have those thoughts, but even if they did, most people wouldn't believe them, right? It's very linear. But that's changing because more and more people are talking about consciousness and the role that we can tap into. And so when people can start to believe that, then they can start to tap in that. And once they can start to tap in, then you're going to see a lot of accelerated healing. And, we were talking recently in the office, which isn't talked about a lot. What is a miracle, right? What is a miracle? Well, to me, a miracle is the same thing as healing. It's just happening very quickly, right? So the example I use is if you have cancer and you spend 3 years doing chemotherapy, radiation, surgery, and now you're healed. Well, that's the same healing as a miracle, but the miracle happened overnight. Both are changing the energetic vibration, right? Both are tapping into that using different tools. A miracle just does it like a light switch therapy. You turn on the switch and you're there. That's 100% possible because it happens. And that takes, like you said, a change in perspective and a tapping into the subconscious to really get at those deep-rooted pathology, trauma, heal them, and now you're a different energetic being. That's what a miracle is. Most people will never believe that because they don't believe that it's even possible.
Right.
But once you can believe that that's possible, then you can start to believe that anything is possible. Then it gets really exciting.
I bet people never believed it was possible that this whole pandemic was going to go down.
Right.
And like, if you would have said, oh, we're all going to have to be forced to be in our homes and this and that, people have been like, yeah, right. Airports are going to shut down. Yeah, right. All this is
never,
we never would have believed it. But yet now it's here and suddenly it's reality. So it's truth. Right. So there's this bigger question of like questioning our reality and what is truth and what's being put in front of us. I think that's really fascinating. And this whole conversation reminds me of, Joe Dispenza's work, which obviously you're familiar of. And for anyone who hasn't heard his story, I recommend that they kind of look into him. But he's a chiropractor. Is that right?
That's right.
And he was a runner. And I think that he was running a marathon or something or a triathlon and was rounding a corner and a car struck him down and he was basically paralyzed, instantly rushed to the hospital. They were like, you're never going to walk again. And he started working internally in an altered state because he had knowledge of the spine and the different vertebrae. He was repairing.
Sure.
He was going like, oh, okay, I'm in C2 now. Yeah. Like, I know this is where the injury is. And he was visualizing it being healed. And then over time, he actually is now he's fully functional, walking, active guy, totally healthy and normal again. And he's lived to tell this miracle story. So,
yeah, it's amazing. And I think that, we can tap, it doesn't always require, these altered states. Like that's one way. And that is a really profound way for people to get there. And I think we're going to learn more and more about how do we, kind of rein in the altered states for healing. I mean, that's the work of the shaman. One of the challenges I think though is, unfortunately, people are going to try to take advantage of that. There's a lot of false shamanism, and people and people need to be on guard for that. And we see it. I mean, it's been through history that, oh, I touch you and now you're healed. Maybe not.
Right.
But we can also, it's the belief. So if you believe that the vitamin C you take is going to improve your immune system, then it will, right? And he wrote the book, I, the Placebo, and it's very powerful. And there's a placebo effect to everything, but all the things we use, whether it's NAD or ketamine, ayahuasca, they are all tools. They're bridges to help us reach that, higher energetic vibration where anything is possible. Yeah.
And I think, to go back to ketamine, and I'm interested more on the protocol, but you're talking about higher vibration. And I think I've been considering this lately. It's like, what is depression? And for me, depression is just a sense of like a complete severing of the connection to yourself and to others. And when you're in that state, even if you recognize like, oh, I don't feel connected to others, I'm alone, and it really sucks and you feel the weight of it. Even if you recognize it, doesn't mean you can remediate that connection. So you really have to get to a point of building a certain momentum until you start like feeling good again. And then you can believe, and then you get the cascade of all the good hormones and stuff. So I'm curious why ketamine specifically is now, being looked to as this new cutting edge therapy for things like anxiety and depression. What does it specifically offer?
Yeah. Well, what I would say, I'll get to that in 1 second, but to your comment, like when you're depressed, it's hard. You can't go from being depressed to feeling great all at once. It's very, very challenging. I mean, you could. What I tell people is all you have to do, or the key to it is there's a couple keys, but one is just being curious what the next step looks like. And I think the challenge there is people assign an attachment to something, right? And there's a value judgment of good, bad, better, worse. And if you're just actually able just to be curious, it means there's infinite possibilities. So when you're feeling really bad, the goal isn't necessarily to go from feeling really bad to feeling really great. But I would say acknowledge, sit with, I don't feel good. Like I don't like how I feel, but I'm curious what feeling better looks like or feels like. And then you invite that, whatever that is, you're going to attract that. And then I tell people all the time, you always, like there's this a truism in life, you always get what you focus on. And the trouble with depression is
law of attraction.
Yeah,
right?
The trouble with depression or feeling depressed is you don't have a good radar. And so you end up staying stuck focusing on the depression. And it's just like an easy example, which I've said before in podcasts, is weight loss, is people struggle with weight because, in my opinion, they're focused on the weight. And even though they say, I'm excited to lose weight, you're still focused on the weight. You'd be better off saying, I'm excited to wear that bathing suit. I'm excited to wear that outfit, because that points you in the direction of where you want to go.
You're focusing on feeling good, right?
You're focusing on what you want.
You're like deepening, or you're pattern breaking, and then you're deepening the grooves of these neural pathways versus staying in the stuck rhythm of like the negativity.
Sure.
Right?
Yeah. And then get back to your question of ketamine. They did a study looking at ketamine versus Prozac, a selective serotonin reuptake inhibitor. And Prozac, when someone starts Prozac, which can be an effective therapy for people with depression, tapping into working on the serotonin neurotransmitter system, they found that while Prozac takes about 3 weeks to start working, ketamine works instantaneously. And that's really where it is. It's the instantaneous change to that nervous system. And so people who do ketamine therapy, for example, here in the office, and that looks like we give them a shot of ketamine in their arm. We do it intramuscularly, not intravenously. It lasts about 30 minutes for select patients. When they come out of that, the vast majority feel much lighter. They will say that they have a different perspective. I think it operates in the way many psychedelics do in terms of quieting the higher processing centers of the brain to allow us to make connections and form, see things, get clarifying insights to things we don't normally do. And when people do that, plus the effect on the nervous system, literally, in allowing our neurotransmitters to conduct themselves more efficiently. So yeah, people come out of that feeling happier. And that happiness lasts for most people. It starts anywhere from 3 to 7 days. And if they keep up with that, then you're kind of building that momentum. And then you're literally retraining that nervous system, because when you feel happier, you're going to be happier. You're going to attract more happiness.
So with these select patients, like how often are they doing it? What's the protocol?
It just depends. We really try to individualize it.
Right.
We like to combine it with NAD therapy because there's really good synergy there. Most centers don't, right? They just stick with ketamine or they just stick with NAD. But for select patients, we first have them have that first experience. And from there, we kind of determine, is it you're going to do this a couple times a week, or you're going to do it every day? It's very variable. In general, though, I'd say people, when they start, are going to be doing it a couple times a week for a couple weeks to see. And then there's things we can do as an outpatient, using ketamine in different forms as an outpatient, as well as, combining that with NAD as an outpatient, meaning not in the office, that they can do at home to give them the tools to allow it to go further.
Oh, that's really fascinating.
Yeah, it is.
Yeah.
It actually is.
Yeah. So, I mean, and so I'm thinking of like, too, this isn't your area, but like MDMA, clinical trials and stuff like that. What are you feeling about, I guess, like what excites you more about ketamine, I guess? I'm from my perspective, like I'm coming from, I have a circle in New York City. I don't have a lot of experience with ketamine at all, actually none. But I know there it's kind of become this like popular party drug. There's the K-hole. And so for a lot of people, this is a hump to get over to even think about it being used in a therapeutic setting, because it is, like you said, like it's a dissociative.
Sure. Well, I think it's like other psychedelics in that people use them and then abuse them recreationally. But that's very different than using things therapeutically as tools. And so there is going to be a divide there in terms of, how people use them, how they perceive them. And if people are using even ketamine recreationally, of course, there's a dark side to that where people can build tolerance. Then, it's habit forming. they can abuse it. What's nice about ketamine, it's very short acting, very, very safe. So we really don't see many side effects. Has to be for select individuals, right? It can't be for anyone who raises their hand and say, hey, I just want to feel better. Like we have to have a goal and plan in place because there is abuse potential.
Yeah.
So
that's a great point. And I always like to talk about the shadow sides of things on my podcast just because I think it brings balance. But, who is this really not for? Who is this in your opinion?
It's for people who tend to have, I'll say this, that the people who tend to have addictive personalities probably could benefit in a very controlled environment. But the people with addictive personalities have to be careful because left untethered, they're just going to get addicted to ketamine. That's not serving them, right? Like, so it's not necessarily good to replace one addiction with another. But, people are using ketamine to replace alcohol, to replace opiates. And that's probably a safer route to go. But, it's hard because for example, we don't necessarily know that, right? Like someone does not necessarily 100% going to volunteer, I have an addictive personality. That can be hard to ferret. So some of it is trial and error. But I think that ketamine is unique in that it's such a safe, profile as a medicine, as a drug. So I think we can push that a little bit with people because it is so safe, which makes it exciting. But still, it's got to be used in that container of therapy. Mm-hmm. That's going to be best.
Yeah, thank you. As we come to the end here, I feel like I want to ask you, many people listening to this, you're just blowing their minds left and right. Like they've never heard any of this stuff and your particular approach to medicine, which I just love so much. What are your top 2 to 3 things that because you have this platform right now, it's like, what would you wish that every person could know? Maybe it's a health tip or a quick kind of life hack or a super vitamin or an adaptogen they should be having. And is there anything that people, in your opinion, should be more discerning about that they're not being?
Those are good questions. I think for me, kind of one of the main themes is the mindset. Like that is paramount. Is number one, it's a choice, right? Like it's a choice. At the end of the day, it's a choice how we feel. And it may be a hard choice and you may have to overcome a lot for that choice to be easier. But your ability to feel good in any sort of environment is up to you, right? And that takes a lot of work because we have trained our kind of primitive brain, the fear brain, that fear is what's, going to save us. Fear is protective. And there is a protective essence to fear, but there's also a very positive and healthy essence to abundance. And that is a choice, right? You can either choose to see the world as a very, safe and vibrant and place that's offering you things, or you can choose to see the world as a very scary place where you need to hide and shelter yourself. And a lot of how you're going to operate in your community and the world around you is dependent on that choice alone. And that choice takes practice because for most people don't know how to get out from under the fear, right? Because most things in life are telling us that fear wins. And so a lot of it, the challenge is also that we're taught in order to succeed, we have to push and battle and fight. But I think the wisdom is that we have to allow and surrender and just be. And it's counterintuitive to people, right? And so they think, if I'm going to really succeed, I'm going to fight through this and I'm going to push hard. When in actuality, if you really want to succeed, it's just allowing yourself to allow what comes in. Again, that's a choice and that has to be practiced. So that's what I'd say. If people are going to focus on anything, it's figuring out that. There's a lot there. I certainly don't know it all, but I think that's the most critical. Anything to everything is right in that kind of all that paradigm. And then to your second point, I think this whole Corona thing brings up it's kind of hitting people very in the core of our being. It's going to challenge us individually, as a community, as a society, of where we want to go. And I think, you brought up this second wave that may come. I don't think people are going to lie down and be so acquiescent the second time. I don't think people are going to stand for being told that they need to stay home and let life happen and quarantine for 2 to 3 months and lose their job, get depressed. I just don't think it's going to happen. I think it's going to be really interesting. And I would encourage people to explore, where they are in that, right? What is really important to you that you're going to want to stand up and be vocal about? Because I think we're heading there. I think there is going to be a point where you're going to have to stand up and make your voice known. Because if you don't, there's going to be some things that are going to be forced upon you. And if that's okay with you, that's great, because again, that's a choice. But if that's not okay with you, then I think there's going to be a time and a place where you're going to be able to express yourself.
That is such powerful wisdom. Thank you so much.
Oh, you're welcome.
I want to ask you, where can people find you if they want to get connected with you online?
Yeah, 2 places. Probably our website is best. So it's Koniver Wellness, Koniver, wellness.com. And then on Instagram, that's our main social media outlet, which is @Koniver Wellness. And we're doing a really good job now of kind of getting back in touch with people. We have several people on our team who really, we understand that we get a lot of inquiries, and we do our best to keep up. We're not perfect, but we really want to help as many people as we can. We have set up this free online educational series that people can sign up. It's a video course over 12 weeks that goes over all these health topics that we want to give to people to help empower them, educate them. So that's a good starting point for most people. Yeah.
Wonderful. Thank you so much,
Thank
Dr.
you.
Koniver.
Thank you for having me.
It's been such a pleasure to have you.
Yeah, thank you.
Thanks.
I sincerely hope you enjoyed that episode, my dear thought roomies. I was just thinking about how much time we spend liking, swiping, double tapping things haphazardly, or scrolling and sharing Baby Yoda memes. A lot of the time, the way that we consume media is truly not on purpose. But I just want to say, if you dig this podcast and you think it has value, I'd like to invite you to consider sharing it on purpose with a friend. When you share something, truly you are voting with your time, the same way that when you buy something, you're voting with your dollars. You're basically saying to the universe, I want more of this. This is the kind of world I want to belong to. This is the kind of world I believe in. This podcast is offered freely because I believe in the power of these interviews to create thought-provoking discussions and elicit personal growth and transformation. If you want a kind of world where that is celebrated and offered to, be sure to hit the subscribe button to this podcast and share this episode with one person you think will love it. We are all connected in this rich, infinite web of knowledge, energy, and information. Your sharing this episode with one person could set them on a new trajectory of lifelong learning, and that could change their life. And so no matter how much you love Baby Yoda memes, you got to admit, that's pretty powerful.